Mr. Stick was in all respects a normal person. Number one, he worked in an office, and number two, he drove a car. He never thought he would get meningiomas, a type of brain tumor. However, he did have some of the risk factors. A, he was over the age of 60, and B, some people in his family had neurofibromatosis type 2, which causes increased risk of meningiomas. However, because women are twice as likely to get meningiomas and he was not a woman, he thought he was safe. However, one day he had to get symptoms. Number one, he had headaches, and after that, his arms and legs started feeling weak. A week later, he had vision problems, and if he knew that he didn't see a doctor soon, he may get seizures, personality changes, and die because those were all possible effects of meningiomas.
So Mr. Stick decides to consult a doctor regarding his symptoms, and just as he predicted, the doctor said that he has a stage 2 melanoma, brain cancer. In order to treat the cancer, Mr. Stick goes through a series of treatments, like surgery to remove the tumor from the two sectors of the brain exists, and he goes through about nearly 2 years of chemo, radiation, and therapy, and eventually is cured of the cancer. A brain tumor, or an intracranial neoplasm, and occurs when abnormal cells form within the brain. Now, in Mr. Stick's case, it was a benign tumor, and this tumor was caused by three main factors. The first factor was an abnormal chromosome 22 given by one of his parents. The second factor was extra copies of the growth factor PDGFR. The final factor was extra copies of the receptor EGFR. And as a result, slowly over time, along with the risk factors of being older and being male, he eventually contracted the disease. Mr. Stick was lucky that his tumor remained benign, as if it was malignant, it would spread to other parts of the body such as the lungs and other fragile areas. For every person diagnosed with brain tumor, 1 out of every 3 will die. Do you want to be a part of one of those 3? Visit the Brain Science Foundation to find out more about brain cancer.